Hello, I'm Hannah. I'll be your nurse today. Could you please give me your name and date of birth?
Taylor Shank, 5/13/01.
Alright, and I double check that with her bracelet and then perform hand hygiene. And today we're going to be doing a head to toe assessment, so if you have any questions, just let me know. Could you please state your name again?
Taylor,
And what time is it?
about 3 o'clock.
And where are you?
Your house.
Alright, so the patient is oriented to time, person, and place. Her speech is clear, coherent, and evenly paced, and her behavior is appropriate for the situation, and she's awake, alert, and easily aroused to verbal stimuli. Alright, so now we're going to check her face, and I'm just going to check in her ears and nose for any drainage, and it doesn't look like there's any drainage. And by looking at her eyes, I can tell that her upper eyelid covers 1/3 of her upper iris. And now I'm going to check her pupil size. So it's about 4 millimeters. And then I'm just going to pull down her lower lid. Okay, so her conjunctiva is pink and moist, and her sclera is white and glistening. And I'm going to check her direct and consensual responses. Okay, and her pupils restrict equal bilaterally. And now I'm going to look at her lips, and they're pink, moist, and intact. And then I'm going to use the tongue depressor. And if you could just open your mouth. Okay, and by looking at her mouth, I can tell that her oral mucosa, gingiva, and tongue are all pink, moist, and intact. And then, could you smile? Okay, so her teeth are white and in good repair. And by looking at her face, I can tell that it's symmetrical. And now I'm going to test her skin turgor. So I'm just going to pinch her clavicle. And it returns within 3 seconds. Well, it returns immediately. And then could you please swallow for me? Okay, so when she swallows, her trachea is midline and rises and falls. And then could you just move your neck left to right, forward and backward, and around in a circle. Okay, so she has full range of motion in her neck. So now we're going to move on to your skin. Could you just go like this? And by looking at her skin, I can tell that it's tan, evenly distributed. There's no edema, lesions, striations, or scarring present. And then I'm going to feel it. And it's warm, smooth, soft, and slightly moist. And so now I'm going to move on to her respirations. So I'm going to do 8 anterior, 10 posterior, and 4 on each of the lateral sides. Oh, yeah. Okay. And could you breathe in and out through your mouth? And then you can breathe normally. Okay, and then go like this. And breathe in and out through your mouth. And then you can breathe normally. Okay, and if you could turn around. Okay, and then breathe in and out through your mouth. And then you can breathe normally. Okay. So from listening to her lungs, sounds were heard in all lung fields, and there was no extra sounds heard, and there was no use of accessory muscles, and her breathing was brisk and Yeah. Okay, so now I'm going to move on to the heart. So I'm going to start with the diaphragm, starting at the aortic valve on the right sternal border, second intercostal space, and then moving to the pulmonic valve, second intercostal space, left sternal border, and then down to the Erb's point, third intercostal space, left sternal border, and then moving to the tricuspid valve, fourth intercostal space, left sternal border, and then ending with the mitral valve, fifth intercostal space, midclavicular line. And then I'm going to go back up with the bell after I'm done using the diaphragm. Okay, and I'm going to switch to the bell. Okay. And S1 and S2 were heard in all of the heart fields. There were no murmurs or extra sounds heard. And then now I'm going to move on to the abdomen. So if you could lay back with your knees slightly bent. Okay, and I'm just going to pull up the shirt. And so her abdomen is flat and contour and symmetrical. And I'm going to start at the right lower quadrant and move up to the right upper quadrant, and then across to the left upper quadrant, and then down to the left lower quadrant and back to the right lower quadrant. And I'm going to listen in each for a minute. For the video purposes, I'm just going to listen for a couple seconds, and I'm looking to hear vowel sounds 5 to 15 seconds apart in each. Okay, and you can sit up now. And vowel sounds were heard in all quadrants within 5 to 15 seconds apart. And so next, we're going to test your lower and upper extremities. So I'm going to be looking at her nails. She does have nail polish on. If she didn't have nail polish, then I'd be looking to see that her nails are convex with no clubbing, and that her fingernails are pink. And then I would check the capillary refill, and we'd want it to return within 3 seconds. And then I'm going to do the same for her toes, which also have nail polish. So I look again to make sure that they're pink and that there's no clubbing and that they're convex. And then I would check the capillary refill as well. And then I'm going to check the radial pauses. Okay, so that's a +2 out of 4 equal bilaterally. And then I'm going to check the fetal pauses. And they're also a +2 out of 4 equal bilaterally. And then next we're going to move on to her muscle strength. So you can push towards me, and then back, and then your feet push up and down, and then your legs pull back, and then push towards me.
You're good.
Okay. So in both her upper and lower extremities, her strength was 5 out of 5, and then your hand grip we're gonna test. Okay, and her hand grip is strong, and equal or symmetrical. And then now we're gonna test her range of motion. So could you stand? Okay, go like this, and then in and out, in and out. Oh, yeah. Okay, and then your leg, in and out, back, side, front, back, side, back, and then your elbows go like this, your wrists, fingers spread across or spread out and in, and then touch your pinky to your thumb, And then your ankles just spin around. And your toes, wiggle those. And then your knees bend up. And then up. Okay, and then your neck, side to side, front and back. And around. And then shrug your shoulders. Back, front. Okay. So she has full range of motion in her upper and lower extremities. And then if you could just walk forward for me. Or yeah, that was fine. Okay, and then back. Okay, so she is coordinated with her movements and her gait her gait is coordinated and her posture is erect. And do you have any questions?
No.
Okay. Thank you.